Good evening, I'm Dr. Akl. Follow up on what I just told you. We will continue with central nervous system tumor. Last few minutes I talked to you about when the tumor spread to the brain, not necessarily that equal death. Today we have special group who do well, and their life expectancy could be more than 5 years. And those good risk patients with advancement in technology and treatment, they are treated and their life expectancy expand. One area, and those patients when the tumor spread to the brain, and if they are good risk, smaller tumor, less number tumor, younger patients, good performance patients from their diagnosis of the original cancer until the time it spread to the brain is longer time. All these are good prognostic factors, predict those patients will do well. There is for those tumor spread from their primary site, say lung, breast, or any other site, to the central nervous system, of great importance to the patients and to the physician to recognize such spread early. When the tumor spread to the brain, many physicians for high risk tumor who got high chance spread to the brain, they do routine MRI and they could detect it. Others, when the patient develops symptoms, and the neurological symptoms could be from confusion, unsteadiness, sensory symptoms, motor symptoms, and so on. Once patient present with any of these symptoms, they undergo MRI of the brain and the tumor is seen and recognized. One important area I want to emphasize in the next few minutes, when the cancer spread to the spinal cord. And when the cancer spread to the spinal cord, that is emergency. Why is that? Because it's compressing the spinal cord, which either start from the neck, thoracic, or lumbar area. The compression itself will squeeze the spinal cord and the patient could be paralyzed. The paralysis could be within few hours. So I'm letting our cancer patients recognize if they develop back pain, because that's early symptoms of spinal cord compression, or early symptom of the spread of cancer to the back, pushing into the spinal cord. Pain, any patient with cancer who develop back pain, we need to have high index of suspicion. We need to rule out spinal cord compression, especially if they have minimum weakness of their legs. And MRI is the test. In the old days we used to do myelogram to see the tumor compressing the spinal cord. That has replaced, the myelogram has been replaced with MRI, which is now the gold standard test to detect spinal cord compression. One spinal cord compression, that is emergency. The patient need to be seen right away. If you are a patient with history of cancer, developed back pain, or weakness of your legs, or numbness, you need to rush to the emergency room, because we need to recognize such a case very quickly, because recognition of such a case will diagnose it early and treat it early, so we prevent further weakness, further paralysis, and hopefully your power, your motor power in your legs, your sensation in your legs comes back. So if you are a patient and develop any back pain, weakness, and you already have cancer, you need to rush to the emergency room as soon as you could. There they will do MRI, they will find the cancer, then you will be seen by a neurosurgeon who might operate on you or send you for radiation treatment. The treatment will be initiated, so the weakness will stop and it could be reversible, so you walk normal again, and the sensation, the funny sensation you will have, numbness and so on, could disappear. Then you will gain your motor power and your sensation again. So it's so important for you as a patient to recognize early symptoms of spinal cord compression, weakness, lower back, weakness, back pain. Rush to the emergency room, and you will be screened to rule out spinal cord compression. If you have spinal cord compression, that will be treated. The neurosurgeon will see you by immediate decompression. There are multiple operations, or sometimes the neurosurgeon send you directly for radiation treatment. A radiation treatment is initiated, destroy the tumor, alleviate the compression. You also will be receiving a pill called decadron or dexamethasone that decreases the swelling around the area of compression, so your recovery will be faster and your treatment will be as quickly. This spinal cord compression, if not recognized, the weakness will continue, the paralysis will continue, and the patient will be completely paralyzed. And it could take few hours, it could take few days, it could take few weeks, depending on the aggressiveness of the tumor. Any cancer patient whose back pain developed any sort of weakness, they need to rush to the emergency room, because if you wait and don't go to the emergency room, the weakness will progress and you could end by completely paralyzed. So it's so important to rush to the emergency room, where they diagnose you early and see if you have spinal cord compression or not. If you do, they need to start, they will let you see specialists and treatment will be initiated, so you will be able to gain your motor power again, and you will be able to walk and get well. If you ignore it, you will continue to be weak, and your weakness will continue and you will be paralyzed. Again, I need to mention that the treatment is not guaranteed, but in big percentage of patients it is successful. If the weakness is minimum, then the recovery is much higher. If the weakness is bad, the recovery would be less than expected. So the chance of recovery from major weakness is less than recovery from less weakness. The less the weakness, or the earlier you are diagnosed, the chance of recovery is very high. If you are 50-50 weakness, the chance of recovery 50-50. If you are completely paralyzed, the chance of recovery is low. So it's so important to rush to the emergency room if you have cancer, develop weakness, back pain.